Msimeki. Doc, thank you so much for joining us this morning. A little bit nervous to be on live TV, saving people's lives, because this is the job, Doc. You've put yourself out there on a different level to help people, so thank you so much for being that person and joining us. This is a scary thing, I think, when you're in the moment. You've got a sick child, your resources are stretched to their absolute limit. Once we have exhausted our medical aid benefits, talk me through that process. What's actually going on here within that ecosystem?
Yeah. So I think oftentimes when people talking about, I've exhausted my benefits, what do I do? What does it actually mean? It helps to think first about, well, how is your medical scheme structured? Because there are lots of different benefits. So which benefit have you exhausted and how? So in broad terms, your medical scheme will have what we call a medical savings and a risk benefit. So your medical savings is like a bank account that it pays for your out-of-hospital day-to-day expenses, your GP, your glasses, your dentistry, and that's the money that's actually yours. So if you leave the scheme, it's going to be transferred the balance to basically, whereas your risk is for your hospital benefits. So typically when people say, I've run out of benefits, they're often talking about that day-to-day, if they have that medical savings. And the important thing there is to actually understand what limits exist within your benefits, because it will help you actually know, what is my benefit, what is the limit, why have I run out?
And people often don't know these things. We don't look at the fine print because we are just so relieved that we got the thing that we needed to get and we tick that box. If we are at that very uncomfortable space now, we'll be feeling stretched, and of course it gets real in winter when your kid comes back with everything that every other child had at school. For that person who has exhausted those benefits and is looking for the next step when the pressure is on, what advice do you have for them?
So I'd say first check what benefits you do have, because sometimes you think you've run out.
Just look through a different lens.
Look through a different lens. So you might find that you bought a plan that has unlimited GP visits, as an example. So actually you could access that. Or you might, in this digital age, have access to a digital platform for virtual screening. You could access that. Or instead of going to the casualty first, go visit your pharmacy. Go see a pharmacy clinic and see a pharmacy nurse.
You might have a vitamin B injection waiting for you there.
Exactly. You might have prevention benefits that you might be able to access. So don't just assume I've run out from what I understand. Actually have a look at what benefits do you have. The other thing you can do is think about what do I have at home? Especially in this cold and flu season, you are probably already have like a paracetamol at home.
Yes.
You have salt and water. I've got a sore throat. Warm water, gargle with it. It will help soothe your.
I love it. You're just like, you're sick, just go and gargle with salt and water, okay? That's great. That's what I expected from an industry professional. No, but it's so absolutely true. Do you know what my wife and I did? We went back through all of our medication, made sure that we knew exactly what every piece of medication was in there, labeled things so we could keep the stuff safe that we needed to keep safe. We literally had a pharmacy in our cupboard that we hadn't been tapping into and buying new when we had anti-nausea, all of those things there. So you're absolutely on the money. The gap that shouldn't exist but is there that we need to cover ourselves for. How does gap cover work and why do you suggest that, or do you recommend gap cover?
So I think firstly, before we look at what is gap cover, there are different kinds of what people consider gap cover.
So how we classify.
Exactly. So if you are part of a medical scheme that might offer something called short payment gap, that's what sometimes people are talking about as gap cover. But typically when we say gap cover, we're looking at what you might buy from an insurer, right?
Okay.
And that often will cover short payments or short claims when you go to hospital. So your provider charges a little bit more than what your scheme rate might be.
Like running insurance within medical aid.
Exactly. So it's to cover what that short payment, that shortfall would be. Importantly, in cold and flu season, it's not really going to cover your acute stuff.
Yeah.
Okay, so
this
you
is
can't.
More over-the-counter pharmacy type.
Yeah. So this is largely going to cover your hospital type. If you landed in hospital for influenza in ICU, please don't.
God willing,
But then it might cover that kind of cost, but not so much your over-the-counter type medication.
I get that. What would you recommend is the best way, as someone who gets to live in the reality of the causality, the repercussions of making the wrong kind of decisions or not being educated in this space? How would you recommend a person approaches their medical aid, their gap cover, just entering into that ecosystem? What advice do you have?
So look at your health needs. Think about, have that conversation with your broker, with your financial planner, to say, what actually do I need for my health needs? So typically what we see, and going back to your first question about running out of benefits, often it's because people aren't appropriately covered for their actual health needs.
What you need.
Exactly. So and you'll notice that say for your chronic condition, but your health need. So I might need a little bit more dentistry, you might need a little bit more optometry. You have a young family, young kids who need to see more GPs, so maybe go on unlimited GP visits as part of the plan. Or you have a chronic condition, or you've been diagnosed with a cancer and you need a little bit more. So actually assess what are your real health needs, and then have the conversation with your broker, with your financial planner to say what medical scheme plan is going to be the best fit.
And there are many. You can become very nuanced. There are all sorts of additional lifestyle add-on benefits and things like that. But I think you've hit the nail on the head. I can understand why you do what you do. To be able to simplify a very complex space is a massive help just in itself. So thank you so much for that. I've never thought about my medical journey like that. It's always about box ticking, having what they have, not what I need. Look at you and your family's needs and build your medical cover around that. Brilliant. Thank you, Dr.